Every single night, somewhere between 60 and 70 million Americans go to bed with a specific fear. Not fear of crime, not fear of economic collapse, but fear of their own stomach. Fear that if they lie down wrong, if they eat the wrong thing at dinner, if they so much as relax for a moment, acid will come rushing up their throat like a chemical fire. Burning, choking, ruining sleep, and here is what almost nobody realizes. In 95% of those cases, the problem is not too much acid. The real problem is that the valve at the top of your stomach has stopped doing its job, and everything you have been told to do about it, every antacid you have swallowed, every dietary restriction you have followed, is making that valve weaker. I am going to tell you exactly what is happening inside your body right now, why conventional medicine has this backwards, and what you can do in 5 minutes a day to restore normal function. But first, subscribe to Dr. Waterling right now and hit that like button. We are working toward 1,000 subscribers, and we are building this channel on one principle. The system makes money when you stay sick, not when you get better. Every subscriber moves us closer to changing that. Look at your life right now. You have cut out coffee. You have eliminated tomatoes, citrus, chocolate, anything with flavor. You sleep propped up on 3 pillows like you are recovering from surgery. You carry antacid tablets everywhere. And still, that burning climbs up your chest, usually right when you are trying to relax, right when you are trying to sleep, right when you need peace. You have done everything the doctor told you to do, and it is not working. Here is what is actually happening. At the junction between your esophagus and your stomach sits a ring of muscle called the lower esophageal sphincter. Think of it as a one-way valve. When you swallow, it opens to let food pass down into your stomach. Then it closes tight, creating a seal that prevents stomach contents from flowing backward. That is the design. That is how it is supposed to work. But in tens of millions of people over the age of 40, that sphincter has become weak. It does not close all the way anymore. And when it stays partially open, stomach acid, which belongs in your stomach digesting food, flows upward into your esophagus, which has no protective lining against acid. The result is chemical burns on delicate tissue. That is the burning you feel. Now here is where conventional medicine gets it catastrophically wrong. When you walk into a doctor's office complaining of heartburn, the automatic response is to prescribe a proton pump inhibitor, omeprazole, lansoprazole, esomeprazole. These drugs reduce stomach acid production by 90% or more. The logic seems sound. Less acid means less burning. Problem solved, except it is not solved. It is masked. And while you are masking the symptom, the underlying problem, that weak sphincter, gets worse. Because your body needs stomach acid, it needs it to digest protein, to absorb minerals like calcium and magnesium and iron, to kill bacteria and parasites in food. When you suppress acid production for months or years, your digestion collapses, you develop nutrient deficiencies, your bones weaken, your immune function drops, and the sphincter, which was already weak, gets weaker because stomach acid itself is part of the signal that tells that muscle to stay strong and responsive. The healthcare industry is not built to fix your sphincter. It is built to sell you acid suppression for the rest of your life. There is no revenue in teaching you how to strengthen a valve. Your next appointment will not include sphincter rehabilitation because there is no billing code for it. Meanwhile, you are spending $50, $60, $80 a month on medications that guarantee you will need them forever. Let me tell you about Margaret. Margaret was 58 when she came to my office. She had been on a proton pump inhibitor for 11 years. 11 years. She still had heartburn 3 to 4 times per week. She could not eat a normal meal without fear. She had developed chronic fatigue, bone density loss, and recurrent respiratory infections because her suppressed stomach acid was no longer killing pathogens. When I examined her, I found exactly what I expected. Her lower esophageal sphincter had the tone of a wet towel. It was not closing. It was just sitting there, loose and unresponsive. I took her off the medication gradually under supervision and started her on a sphincter strengthening protocol. Within 3 weeks, her heartburn frequency dropped by half. Within 2 months, it was gone completely. She could eat normally, she could sleep flat, she regained energy because her body was absorbing nutrients again. That was 6 years ago. She has not taken an antacid since. Now let me explain exactly how this works. The lower esophageal sphincter is skeletal muscle, just like your biceps or your quadriceps. And just like any other muscle, it responds to specific stimulation. It gets stronger when you use it correctly and weaker when you do not. The problem is that modern eating habits, modern posture, and chronic stress have created a perfect storm of sphincter weakness. We eat quickly, we eat while distracted, we eat processed foods that do not require proper chewing. This means the sphincter opens and closes in chaotic patterns instead of strong, rhythmic contractions. Over years, the muscle loses tone. It stays partially open even when it should be sealed tight. Add to this the fact that most people over 50 have developed a hiatal hernia without knowing it. A hiatal hernia occurs when part of the stomach pushes up through the diaphragm into the chest cavity. This distorts the angle of the sphincter and makes it even harder for the muscle to maintain a seal. It is not a dramatic injury. It is a gradual anatomical shift caused by weak abdominal muscles, chronic coughing, heavy lifting with poor technique, or simply the cumulative effect of gravity over decades. When you have a hiatal hernia, no amount of acid suppression will stop reflux because the problem is mechanical, not chemical. Here is what you actually need to do, and this is not complicated. This does not require equipment. This does not require a prescription. What it requires is 5 minutes of your day and the understanding that you are retraining a muscle, not managing a disease. First, you need to restore proper stomach position and diaphragm function. Every morning when you wake up, before you get out of bed, perform this maneuver. Lie flat on your back. Take a deep breath in through your nose, filling your belly, not your chest. Your abdomen should rise, and hold that breath for 3 seconds. Then exhale slowly through your mouth while pulling your belly button toward your spine. Feel your abdominal muscles engage. Repeat this 10 times. What you are doing is activating the diaphragm and the core muscles that support proper stomach position. This gentle rhythmic pressure helps pull the stomach back down if it has herniated upward, and it prepares the sphincter for proper function during the day. Second, you need to perform sphincter activation exercises. These are based on the principle that the lower esophageal sphincter responds to swallowing patterns. Here is the protocol. Sit upright in a chair with your feet flat on the floor and your spine straight. Take a small sip of room temperature water, approximately 15 to 20 milliliters, about 1 tablespoon. Hold the water in your mouth for 2 seconds, then swallow it in one deliberate, conscious movement. Pay attention to the sensation of the swallow. You should feel the water move down your throat in a smooth wave. Immediately after swallowing, tighten your abdominal muscles as if you are bracing for a light punch to the stomach. Hold that contraction for 5 seconds. Release. Wait 30 seconds. Repeat. Do this 10 times. The entire sequence takes 5 minutes. What this does is retrain the coordination between your swallowing reflex, your sphincter closure, and your abdominal pressure. The conscious swallow activates the sphincter in a strong, complete contraction. The abdominal brace immediately afterward reinforces that closure by creating positive pressure in the abdomen that supports the sphincter seal. When you do this daily, you are giving that muscle the stimulation it needs to regain tone and responsiveness. Third, you need to address the root cause of acid reflux, which is almost never too much acid, but rather too little. That sounds insane to most people because the burning feels like acid overload. But here's the truth. When your stomach does not produce enough acid, food sits in your stomach longer than it should. It ferments. It creates gas. That gas increases pressure inside the stomach and forces whatever weak acid is there up through the incompetent sphincter. Low stomach acid causes reflux. High stomach acid in a healthy person with a functional sphincter does not. How do you restore proper acid levels? Through bitter stimulation before meals. Bitters are plant compounds that trigger acid production through receptors on your tongue. 15 to 20 minutes before your largest meal of the day, consume this. Take 5 to 10 milliliters, about 1 to 2 teaspoons, of apple cider vinegar diluted in 100 milliliters, about half a cup of water, or chew on a small piece of fresh ginger root, about the size of your thumbnail, or eat 3 to 5 leaves of fresh arugula. Any of these will activate bitter receptors and signal your stomach to prepare proper acid levels for digestion. When your stomach has adequate acid, food digests properly, gas production drops, pressure normalizes, and reflux stops. Fourth, you must change when and how you eat. The modern pattern of eating constantly, snacking every 2 hours, drinking coffee on an empty stomach, this destroys sphincter function. Your sphincter needs clear on and off signals. It needs to know when to be open for food and when to seal completely for digestion and rest. Here is the pattern your body was designed for. Eat your first meal at least 1 hour after waking. This gives your digestive system time to fully activate. Eat your last meal at least 3 hours before lying down. This ensures your stomach is empty before you sleep, and there is nothing to reflux, even if your sphincter is not perfect. Avoid eating or drinking anything except water between meals. No snacks, no coffee with cream, no juice, nothing. Give your stomach 4 to 5 hours between meals to complete digestion, empty fully, and reset. This alone, in my clinical experience, reduces reflux episodes by 60 to 70% within the first week. Fifth, posture correction is non-negotiable. When you sit hunched forward, when you slouch, when you wear tight belts or tight waistbands, you compress your stomach and increase intra-abdominal pressure. That pressure pushes stomach contents upward against a sphincter that is already weak. Sit upright, stand tall. Imagine a string pulling the crown of your head toward the ceiling. Keep your shoulders back. This creates space in your abdomen, reduces pressure, and allows your sphincter to function without mechanical interference. If you work at a desk, adjust your chair height so your hips are slightly higher than your knees and your screen is at eye level. This forces proper spinal alignment and reduces abdominal compression. Now let me address the question everyone asks. What about food triggers? What about the lists of foods to avoid? Coffee, chocolate, tomatoes, citrus, spicy foods, fatty foods, the endless restrictions. Here is the truth. Those foods do not cause reflux. A weak sphincter causes reflux. In a person with a strong functional sphincter, you can eat tomatoes, drink coffee, enjoy chocolate, and your sphincter will do its job. It will stay closed. The acid will stay where it belongs. But when your sphincter is weak, yes, certain foods make it worse, because they either relax the sphincter further, or they increase stomach acid production temporarily, and that extra acid refluxes through the incompetent valve. The solution is not to avoid those foods forever. The solution is to strengthen the sphincter so you can eat normally again. That said, during the initial 3 to 4 weeks of sphincter rehabilitation, it makes sense to avoid the most problematic triggers, not because they are inherently bad, but because you are retraining a muscle and you want to reduce unnecessary stress during the healing phase. The primary offenders are caffeine, which directly relaxes the lower esophageal sphincter, alcohol, which does the same, and peppermint, which despite being marketed for digestion, actually relaxes that valve significantly. Avoid those 3 during the rehabilitation period. Everything else you can eat in moderate portions as long as you follow the timing and posture guidelines. Let me tell you what you should see if you are doing this correctly. Within the first week, you should notice fewer nighttime reflux episodes. Sleep will improve. Within 2 to 3 weeks, daytime heartburn frequency should drop noticeably. You should be able to eat meals without immediate burning. By week 4 to 6, if you have been consistent with the exercises, the meal timing, the posture correction, and the bitter stimulation, reflux should be rare, perhaps once a week or less, and mild when it occurs. By 8 to 12 weeks, most people are completely symptom-free and can reintroduce foods they had been avoiding without problems. Now I need to be very clear about something. This protocol works for functional reflux caused by sphincter weakness. It does not apply to everyone. If you have severe erosive esophagitis, if you have Barrett's esophagus, if you have a large hiatal hernia requiring surgical repair, if you have esophageal strictures or motility disorders, you need specialized medical management. Those are structural problems beyond sphincter rehabilitation. If you have alarm symptoms, and you need to know what those are, blood and vomit, black tarry stools, severe chest pain that radiates to your arm or jaw, difficulty swallowing solid foods, unintentional weight loss of more than 5 kilograms in a month, those require immediate medical evaluation. Do not attempt self-management. See a gastroenterologist. Also, if you are currently taking a proton pump inhibitor, do not stop it abruptly based on this video. These medications cause rebound acid hypersecretion when discontinued suddenly. Your stomach, which has been suppressed for months or years, will overproduce acid for 2 to 4 weeks after stopping the drug. This creates worse symptoms than you had originally, and most people interpret that as proof they need the medication forever. They do not. They need gradual tapering under medical supervision while simultaneously implementing sphincter strengthening. Work with your physician, explain what you are doing, request a tapering schedule. Most doctors, if you present this rationally and demonstrate commitment to the behavioral changes, will support it. Here is your complete daily protocol. Morning, as soon as you wake while still in bed, 10 cycles of diaphragmatic breathing with abdominal engagement. Then get up, drink 250 milliliters, about 1 cup of room temperature water. Wait 1 hour before eating. 15 to 20 minutes before your first meal, take your bitter stimulus, apple cider vinegar in water or fresh ginger or arugula. Sit upright to eat. Chew thoroughly. Stop eating when 80% full, not completely stuffed. After finishing, perform your 5-minute sphincter activation exercise, the conscious swallowing sequence with abdominal bracing. Do not eat or drink anything except water for the next 4 to 5 hours. Repeat the bitter stimulus before your second meal if you eat twice per day, or before lunch and dinner if you eat 3 times. Finish your last meal at least 3 hours before bed. Before sleep, 1 more round of diaphragmatic breathing, 10 cycles, to relax the diaphragm and support proper stomach position overnight. That is it. That is the protocol. No expensive supplements, no prescriptions, no surgery, just anatomical understanding and consistent practice. How old are you? Write it in the comments. I want to see which age group makes up the majority of our viewers because it will directly shape what I cover in future videos. If this video helped you, if you finally understand what has been happening in your body, if you now have a clear path forward, send it to someone you care about, a parent, a spouse, a friend who complains about heartburn, who lives on antacids, who thinks this is just something they have to accept. You may have just given them the information that changes their next 20 years. Subscribe to Dr. Waterling and help us reach 1,000 subscribers. We are building something different here. We are not selling you products. We are not promoting pharmaceutical solutions. We are teaching you how your body actually works and how to restore normal function through understanding. That is the mission. Every subscriber tells the algorithm that this information matters, that people want truth over marketing, that health education should serve patients, not profit margins. Your heartburn is not a Nexium deficiency. It is not a Tums deficiency. It is a weak muscle that nobody taught you how to strengthen. Now you know. 5 minutes a day, conscious effort, consistent practice, and in 6 to 8 weeks, you will eat normally, sleep normally, and live without fear of your own stomach. That is not a promise. That is what happens when you address root causes instead of suppressing symptoms. Your body knows how to heal. You just have to give it the right conditions.